Hello, everybody. Thank you, thank you for giving us the opportunity to present on Mass Casualty Tracking Reunification Arizona Collaborative. We'll get our PowerPoint up here in a sec. Here it comes.
Do you want control?
Oh, yes, I will take control. Thank you. Okay, so this is the regional approach to mass casualty tracking and reunification. Victim tracking and reunification, actually. We started MCTrack about a year ago. You can say MC track, you can say MIC track, potato, doesn't matter whichever way you say it. It started with both Chief Glass and I, and now it has reached to about over 90 agencies helping us in this process and building this program with us. So we're happy to share it with you. Okay, the need. I'm going to go through these. We don't have to go too far to see the need every day. We see this in the news. We see this happening across the nation. We also see what it does to our healthcare workers and to our first responders every day. We know we don't have to wait for it to happen in our neck of the woods to do something about it and to pre-plan for it. And so that's what this is all about. How can we pre-plan for this? How can we be ready in case this were to happen to us? Why do we want to do this? We want to do this because saving a life, next to creating a life, saving a life is the best thing we can do. We want our first responders to be able to go out there and do what they do best and save lives should something like this occur in our region. What we've done is we have taken a look at our resources collaboratively, and we have looked at them and made sure that we get the right people at the table so that we can talk through this, so that we can learn from the experiences they have every day responding in the field, and we get the right people at the right time in the right places. So where did we start? Well, we actually started, we were partnering with Chris, who just spoke at Sky Harbor Airport, and Coyote Crisis. We held a targeted event readiness forum last June. And what that was about is a jetliner crashing into Tempe Town Lake on its way to Sky Harbor. We've always thought about that. I know that our first responders, law enforcement, fire, EMS, I kind of went around being their first emergency manager, kind of walked around and said, so what keeps you up at night? What do you guys want to do? You know, we could do exercises, we can start talking about what we need to prepare ourselves. What scares you the most? And that was one of the things. How do we communicate with the airport? How do we communicate, period, when something like that happens? What does it look like? How do we respond to that many potential fatalities and injuries? And what would that do to our city? So we started discussing this, and we had 125 people there from local, regional, state, and we even had national partners that came that day. It was a whole day-long conference, talking that scenario over about what we could do and what that would look like. 32 items came up for consideration, and out of those, 10 served as the catalyst that made this why we're here today happen. It was the fact that we had gaps that we needed to look at. We needed response for regional mass casualty. We knew it. We knew it was a gap. We knew we needed to work together, and we thought, well, let's put our heads down and do this. So these are the agencies we brought to the table. I'm going to click through here. Hopefully I won't go past it. Let's see. Now, we always talk about this in emergency management, getting the right people to the table, but I can one-up that. What we're doing is getting the right people to the table, but the people, not just from the agency, but the people that are actually responding in the field right now. The people that know what's happening out there. They know the resources they have. They know the response timeline. They know what they need out there and what would happen. If this were to occur tomorrow, they would know how this would go just by simply, we would all know, by the way they respond to smaller incidents every single day. What resources do they have out there? Who comes to assist them? What's their response timeline? What's their staffing right now? We need to keep on all of that so that we know if this were to happen, what it would look like. So we needed to start a discussion. That targeted event readiness forum that I talked about is not a tabletop exercise. It's simply a discussion. The people around the table at a turf, you can call it turf, they have surfs too. They really do have turfs and surfs. The people around the table are people that actually are responding every day. The facilitator of a turf is somebody that they trust that responds with them every day. And we don't look at plans in a turf. We don't want to look at plans because what happens is sometimes when you have tabletop exercises, I'm not saying this happens all the time, but it happens, I think the majority of the time, is we have people that come from the agency and they sit with their plans and they look at their plans and it comes to their time to talk and they read their plans off and say, we would do this. And that was probably written by somebody else in an office maybe 2-3 years ago. And it was up on a shelf. They dusted it off and they just read it. And they're like, okay, I'm good. I didn't make a fool out of myself. I said what I needed to say and we're good to go. And kind of everybody does that throughout a tabletop. Unfortunately, that's what happens a lot. When we don't look at plans and we have the people there that really need to be there, that respond every day, then we have a conversation. And we have a realistic timeline. We can realistically look at what would actually happen. When somebody says they can respond in an hour, can they really respond in an hour? Because we really need to know that. Because we're going to have to plan accordingly. So realistically, we need to know what will really happen. It also takes the assumption out of our planning. We need to take those assumptions out. We need to know what will realistically happen. And it kind of leaves the egos at the door, too. Because everybody just feels safe. It's a safe environment. You can have candid conversations. We're calling that reality planning. It's like reality TV, but it's reality planning for emergency management because it is realistic. It's what's happening today. It's what will actually happen out in the field. And this is our progress. What we've done is we've been very strategic and very purposeful in the development of this. We have brought everybody on board, all of our agencies, and we have built this from the ground up. The people around the table that respond every day built this from the ground up. So that's actually what's happening out there. It's the best way we can respond. We know what's really going to happen. And what we've done is we brought them in individually, every part. So we have over 90 agencies, different fire agencies and law enforcement, EMS, Red Cross we brought in. We have many agencies, hospitals. Brought them in and just talked to them individually and asked what their concerns were in response to a mass casualty incident. So we could understand them. We talked about our concept and we had them kick holes in it and kick it around and let us know if they see any issues with it. And we really listened. And that's what we've been doing this whole time, is listening to each other. This is like a preparedness, an emergency management cycle kind of this is, where you plan, you test it, you exercise it, and then you go back and you develop your after action. But this is a little tougher. We want to kick it around, and we want our plan never to be final. So this will never be signed off on and stuck in a shelf somewhere. Because we feel that when that happens, we kind of forget about it. We want to continually look at this plan, continually exercise, stay together. I tell everyone this is Hotel California, that once they're in, they're not getting out. And that's the way we've done it. We've brought everyone to the table and we're continually planning. We'll exercise together as a group because when this happens, if this ever happens, we would have to respond together as a group. And so this will be dynamic and continually. They'll never have a final plan. And this is our framework. So our number one priority is life safety in our framework. What happens and what has happened in the past is we have fire and EMS and law enforcement, our first responders go out there, and we've seen it time and time again, especially like a violent event, such as like an active shooter, something like that. We see people fleeing the scene. We see them going into trucks and cars and Ubers and going to the hospital as quickly as they can. And yet we send our EMS out there, our first responders out there, with a password and a badge or a tag to put on a patient. And it's not realistic and it's not feasible to do something like that. We need to allow them to do what they do best and respond and save lives, and to do what they need to do to save as many lives as they can. So we need to give them that priority. So that is our number one priority. We capitalize on the use of existing resources. So when we get together, a lot of times, we concentrate on our own agencies, on what we have a lack of. Oh, we have gaps in our agency for this. But when we just concentrate on that and we focus on our own gaps, we fail to see what others bring to the table. And so doing this, we've looked at what does everybody else have? What can we use to fill that gap? What can somebody else bring to the table that could help us, instead of concentrating on what we have alone that isn't good enough or we have a gap in? We also rely on collaborative capabilities and not on a specific system. So we do have platforms here. We rely on all our partners to respond with us. We rely on all our partners to plan with us and to be with us throughout this whole process. And that's important. That's what's going to get us through a day like that. We need each other. We need each other in the field. And our priority, we provide additional resources and instead of giving extra tasks, sorry, I'm used to seeing this in front of me. So we're providing additional resources. So we're not providing additional tasks for our EMS when they go out there, like to put a triage tag on or to look somebody up or try to track somebody when they're running and fleeing from an incident. We're actually giving them more resources so they can do that more efficiently and more effectively. And this can be scaled up or down, and it can be adapted to all different kinds of incidents. Now, initially when we planned this, we didn't plan this for that. We planned this for an active shooter, because we knew that was one of our priorities. We knew that that could happen because we have a lot of events, a lot of special events that happen around this area, especially now fall's coming. We're going to have more and more events. And we know that's one of our priorities. So we started it around an active shooter. But when you do hear it today, we're going to tag team. So Chief Glass is going to give you more of the whole concept from beginning to end. When you hear it today, you'll see that you can pick and choose, kind of like an a la carte menu, what that hazard or incident could be, and you could scale it up or down. So that was kind of just a really happy accident, actually, that it turned out like that. And so we could use this for a lot of our responses for anything we can imagine. Wildfires, building collapses, things like that. Our basic principles. So we know that when we all get together, we get really excited and we think, oh, we could do this and we could do that, and then we could add this and we could do that. But if we did all that, it might not be feasible or cost effective for people. So we built some basic principles: simple, realistic, feasible, interoperable, and cost effective. Everything we've been planning, we put up against these basic principles. So everything in here had to be this, because we might have a lot more resources here in the city of Phoenix, in Maricopa County, but in a rural area, they don't have as many as we do. So we need to make sure that they could use it as well, that it could be cost effective enough and feasible for them to use it as well. So we put everything we planned up against these basic principles. We also know that these are unique considerations. When we have violent events, these are unique considerations. These are time sensitive. We need to get them to the hospital within an hour, the golden hour. We need to get them because they're bleeding out, potentially. We need to change the way we respond. When we see these injuries aren't like anything we've seen. A lot of times they're like combat injuries. And so they're different. And we need to make sure that when people are fleeing to the hospital, we need to allow them to flee to the hospital so they can get there. We'll get them there, but we need them to go to a hospital with someone with a knife that can fix them, that can help them, that can stop the bleed so that they can survive and we can increase survivability rates. These incidents a lot of times will spread across areas, and whether that's because people are fleeing because they're afraid of what's happening, or if there's a complex coordinated attack and there could be another shooting down the road or a bomb across the way. So that makes it a little different for us to respond. And there's a change in standards. So we need to allow our first responders to do whatever it is that they need to do on scene to increase the survivability of all the victims on scene. So what is the plan? I'm going to switch it over to Chief Glass, and she'll describe the plan from beginning to end for you.
Thank you, Michelle. So the plan, where did the plan go? There we go. So the plan. So what we learned from the turf was that pre-alerts and early alert notification was critical in trying to get resources stood up. And with fire EMS or law enforcement, we get a tone and then we respond and then we can immediately start requesting additional resources and they come automatically. That's not the case with some of our other partners. So what we learned was that we needed to do a pre-alert that goes through our regional dispatch center. And this alert will go to the Office of the Medical Examiners, to the hospitals, and to all of the emergency managers. So there's a preset list that is combined, and it's set up with our regional dispatch center. And essentially it's saying, be on alert, we might have a large-scale incident or mass casualty. So essentially, don't get on that plane, don't go to dinner, whatever that might be. Just be alert because we might have something of large scale. Then once we get on scene, we will do an alert confirmation. So once we know the magnitude of the scene, then we will send a push message out, again, through the regional dispatch center, so either Phoenix or Mesa Alarm Room, to these groups, to the medical examiner, the hospitals, and the emergency manager. And essentially, that will let them know a rough idea of the magnitude of the scene and that they need to start preparing all their resources. So an example for us would be Battalion 271's on scene. We have an active shooter that has been taken out. We have estimated 25 shooting victims. Hundreds are fleeing the scene. Prepare for a surge. Stand up all your resources. We also at this time can cancel the alert. So if there's no mass casualty associated with it, we just cancel the alert. You go back to business. This is a redundancy because right now the hospital systems have EM resource. So they have a messaging system through EM resource. So this is simply a redundancy to the hospital. But the emergency managers and the medical examiner's office were left out previously. And so this gets some of those resources going that are critical to be able to handle a mass casualty event. After that alert comes out, what will happen is the hospitals will start standing up their hospital command center. They'll start readying their resources, so calling in for additional doctors, anesthesiologists, trauma surgeons, nurses, anything like that. They'll get those resources called in. They'll start readying their logistics and supplies, so blood products or any bleeding control, airway type of devices, anything like that. They'll also start readying their facilities, so surgery suites, critical beds or critical assets that they might have, they can start to open up and they can start to stop any elective surgeries because they know there's going to be critical assets for these type of victims. At the same time, our medical examiner is going to start preparing for large-scale fatality management. And I'm going to just go through that. So essentially, they are going to prepare, again, for additional resources, so staffing levels. They are going to prepare for large-scale fatality management, transportation capability, storage capacity, and decedent identification. It takes a lot of time sometimes to identify these decedents or those who have passed away. And so understanding that and get that ball rolling as soon as possible is critical when it comes to this. What we didn't realize and what we had just assumed is you make that call and then they're just ready to go. We also didn't realize that summertime is peak season for the medical examiner's office, and they are almost at or are at max capacity the entire summer or during the summertime. So understanding this and have a better appreciation of what they actually have capacity-wise, what they have resources with staffing, and what their workload is already at, and then you add this on top of it is very important. The next thing that we're doing, and this is shame on us because we failed at this for quite some time, we're actually going to start using our emergency managers appropriately. And our emergency managers are a critical piece with this. So that emergency manager for the city that it occurred in is going to stand up the emergency operations center. When they do that, it gets the ball rolling, and this is all while we're responding and taking care of what we need to. Once they stand up the emergency operations center, they're going to activate a local reunification coordinator. So each city will designate a local reunification coordinator within their city and a backup. And then that person will be responsible for opening up a family reunification center. So the cities will start to plan out and map out multiple location sites that they can have within the city, pre-plan the area. And so that way, all of that work is done ahead of time. And depending on where the incident occurred, they will go to the closest area that's appropriate and open up that family reunification center. So that local coordinator will have a team of city department employees So human services, community services, risk management, crisis teams if they have them, anything like that, they'll build their team internally, and then they will activate that local team to start opening up the Reunification Center. The emergency manager also is going to activate the Joint Information Center, or the JIC, and that will be so messaging can get out and pushed out to the community accurately and as soon as possible, because we know that's critical during a mass casualty as well. Then what will happen is the emergency manager will notify the duty supervisor with Maricopa County Department of Emergency Management, or MCDEM, and they will be able to help with some of the other services. One of the things that MCDEM will do is they will activate a deployable reunification team. So as part of this, we realize that we're not great at reunification. We don't do it often here in Arizona, or ever. We don't train on it, we don't drill it. It is not a common thing for us. We're getting better on that, but it's not something that we practice regularly. And so what we did is we have a deployable team that's comprised of Red Cross, ACTIC, which is our local fusion center, which is Anti-Counterterrorism Intelligence Center, Crisis Response Team, Department of Child Services, and then representative from the Medical Examiner's Office. So those are the 5 core components of the deployable reunification team. Humane Society is also available to assist, and then our COAD and our VOAD partners are also available to assist depending on the magnitude. And so that becomes our deployable asset that will supplement the local reunification center with anything they may not be able to coordinate. And then the final thing is MCDEM will activate, or will notify Maricopa County Public Health, who will activate the local call center. And then they can scale that up depending on the magnitude up to a national level with Red Cross if needed. And again, that's to take some pressure off our local law enforcement call centers and dispatch centers. So while all of that is going on in the background, we are responding to the incident with fire EMS assets. One of the things we talked about is we're going to differentiate between 2 types of incidents. We have an MCI-1 or an MCI-2. MCI-1 essentially is I have a lot of patients that are centrally located, and they are, let me get this up. They are centrally located. They're really waiting for us to help them. So this is more of your plane crash, this is more of your structural collapse, that type of incident, where they're really all in a designated area and they're waiting for us. The other part about that is they're most likely going to be transported by ambulance through us. So what we did is we try to keep our practice as close to normal to what we do in our everyday operations. And so we have, this is basically just what we would dispatch to get resources there. And then what we do is call for additional resources through greater alarms, and then we can add hazardous materials, technical rescue as needed. But it's very close to our common practice that we do day to day. Because when you have a mass casualty, you're overwhelmed right away. You revert back to the most basic training and functioning. So you have to keep it as close to that as possible. The MCI-2 is going to be more of our active threat, active shooter type of incident, where we feel like there's going to be more chances of people fleeing the scene immediately. And so that becomes our MCI-2. What we found with this is hospital surge with no or little notice is more likely. So we have concerns about that because they will get overwhelmed quickly. We also know that with these type of incidents, that it's more likely that they go in their own vehicles or other means of transportation, Ubers, Lyfts, anything that they can find to get to the hospital. And we want them to. We want them to flee, get to the hospital as soon as possible, because we can capture them there. Because what we changed with our deployment is we have the same base package that goes to the primary scene, but we're gonna send one of our advanced life support units to the 3 closest hospitals in perimeter to the incident. And we will be there to help with triaging and treating those patients. So we'll capture them there and we'll help support and supplement the hospitals with care. This was done in Las Vegas following the October 1 shooting. They have 5 units that they send to the closest hospitals. And so this is mirroring that practice, and you're gonna see this become more common practice, I believe. What we're also doing is we're treating the hospitals now as an extension of our primary scene, where we didn't do that before. So before we would treat, get them off the scene, and then we were done. That's not the reality. And so these are an extension of our scene. These now become sectors for us, and this is just more for fire, what we do, but they become a sector. And so now that first in company officer on that ALS unit is going to be a conduit to communicate between the hospital and to our unified command. So now we bridge the communication gap that we had between the two. If additional resources are needed, they can call for additional resources. If they're getting surged really bad, they can let them know, and if we can transport further out, let's get them further out so we can try to decompress the hospitals. And so this is a means for us to really help support our hospital systems in being able to treat these mass number of patients that we will see. The other thing is because all of the hospitals were alerted and got that text message, if there are victims that are going to other hospitals that are not in that 3 closest, they can call for additional resources. So they can call to the alarm room and say, we're getting surged, can you send a resource here? And then now they become another sector, and now they can call for additional resources, and we just branch out as needed. The other thing that we identified as a major gap was security. This one was a tough one as we were working through this process because law enforcement is going to be very stretched thin, and they are limited with staffing anyways, we all are. And so getting security to the hospitals and to the FRC is incredibly important because of family, media, or any other bad actors. The hospitals and FRCs become a soft secondary target. So if it's an active threat, active shooter, that becomes a potential for more harm and threat. And so how do we get security there? When we first asked law enforcement, they said, well, we can get there in about 5 to 6 hours. And we said, well, that's not gonna work. So we need to figure something else out. And that's what we did. We partnered with Department of Public Safety, DPS, and they will release their assets immediately if we request it through either a unified command or through our emergency manager. And DPS will go to the hospital and assist with perimeter security and traffic. They will also do that at the FRC. And so they will partner with us. If it goes beyond 12 hours, 12 to 24, then we have to do a formal declaration that will go from the local, county to the state level, and then they can release those assets. But this fills that gap. The other thing that we saw with law enforcement, they've been teasing fire for years about staging. They make shirts up about it, about staging and waiting for police to make it secure to get into a scene. Well, they're now seeing the benefit with staging. And so they are now having staging officers. So as a lot of resources come in, they will have a staging officer that they go to, and if they need them at the scene, they send them in. If not, they can redeploy them over to a hospital or to a FRC. And so we're starting to use our resources more efficiently and more effectively. And then we get into the platform. I'm gonna do a shameless plug because I have the opportunity here, but the gentleman who helped create this platform is right over here with Honor Health, Corey. So this is the exciting part for us, is creating a victim tracking platform, a family tracking platform that we can actually enter into the system. And so we identified that we would have a photo identification coordinator or a PIC position because Michelle loves her acronyms, as does every emergency manager. And so we have the PIC position. And this is a HIPAA compliant cloud-based product. It's a push-up only product, or at least for this side. And basically, under Health and Human Services Mass Care, we can use photos for victim reunification. And so we fall under that. So we made sure that legally that we can do all of these type of behaviors. So we created a platform to be able to track and enter in our victims. And what it looks like is very simplistic, but essentially it's with a QR code or a link. And we would go in and we would say, I'm with Fire EMS, I'm with Tempe Fire, so it has all the different fire departments in there. We can preset the different large-scale special events or just have it as MCI 1, 2, 3, or 4. So if we have several events going on, we can differentiate. And then we identify which hospital we're staged at. After that, it goes and it takes a picture. That first page that we just re-entered will auto-populate. So that saves us some time as we're entering mass numbers of victims into the platform. So basically we do the triage level. We ask for gender, estimated age, estimated height, estimated weight, hair color, eye color, and identifying features. So if they have scars, if they have tattoos, if they have glasses, if they have special needs equipment with them, if they have any of that stuff, then we can put that into the system or document it. If they have tattoos, it'll do a photo icon or a camera icon, and we can take a picture of the tattoo as well. So if they have any disfigurement to the face, then we can have the tattoo as a possible way to identify them. And then we take a picture of their ID if they have that. Now we get a question all the time is, can you scan it and does it auto-populate that information in? We're not there yet. It's on our radar. We're trying. But that is something that we identified that we want to move to help get that information in. Then once we hit new victim, auto-populates the first. Now I'm ready to take the picture and get the next person in. Family members will never see these pictures. So these are solely for victim reunification, and these are only the victim coordinating unit will actually have access to these pictures, and it'll be used solely for reunification. So I want to make sure we're clear about that because we don't need to traumatize families any more than they already are. So they will never see those pictures. Login password protected on the back end. So be able to access it, login and password. Then what we do, and this was something that we talked about, is what you see with a mass casualty is families walking around with pictures of their loved one saying, have you seen? So we said, why don't we use that to our benefit? So we'll send a QR code out through media or social media, and that QR code will be so families can enter in information about their loved one. So we'll send that out, they'll put their name in, or the family member's name that they're looking for, their date of birth, their gender. They will do their height, estimated weight, hair color, eye color, and then identifying features. So you can see we're doing the same characteristics that we had with the other platform. And so as they enter in that information, we're hoping that some of the result is that they don't feel helpless, that they actually are helping us to find their loved one, and they're not just sitting there helpless. Once they put that information in and upload a picture, after that, they will enter in their own information, their contact information, so their name, their phone number, their email, because we will send an email confirmation. So if they're unable to screenshot, if they're unable to write down the confirmation code, it will be emailed to them. And then how they're related to them and if they're legally related. So we have that information associated with the platform. Once that comes in, then we get a confirmation code. So we'll never call up and say, I found Johnny. We'll say, do you have the confirmation code for the person you entered into the system? Because we really want to make sure we have it right before we reunify them with their loved one. We also can put in the location of the FRC prior to sending this out. If we can do that switch or that quick addition, we can put that information in. So when they get that confirmation, they know where to go. So the back end of the platform, I'm actually going to go to the next slide on this one. So on the back end, very simplistic. It is Excel spreadsheets that we can filter through. And so what we did is we wanted something that you can do just-in-time training. We don't want something that's so complex that you have a 40-hour training that you did 5 years ago, and then when you go to use it, you can't remember how to use it. We need something that's simplistic that you can use on the fly, and you can have just-in-time training. So what we have on this, victim tracking side's the one that I would enter in at the hospital with Fire EMS. We have a status tab that will say researching, submitted for review, and then reunited. And if it's blank, then it means that person still needs to be worked on. We have a space next to that, which is our family reference number. So when we have a match, we would take the number from below and we would fill that into that top area so that we have two numbers in there if we think that we've found the match so that they can confirm and look at it with fresh eyes. Once we have a match, we can scroll over and we would identify where that person was located at, so which hospital they were transported to. The beauty of this is that we can then filter. So it already has it designated with males, females, under 20. So I can already go and just separate out and say, I want to start with all males. Then I can go, I want all males, brown hair, blue eyes. So you work with a team of 2, they filter down, and then they start matching up the photos. So that's where we're at now. The other thing that we can do is we can share an EOC view. So this can be a view that can be shared with city leadership because we are not giving away any protected information. It's rough numbers and the level of triage that we have at the hospitals. We can separate out and filter it out so that we just have hospital A and show how many of those severity of each trauma is, or we can do a total view of it and show how many total are at our hospitals and the severity of it. So this can be shared with your city leadership, your EOC. This also can be shared with the medical examiner's office. So as I said before, they're very lean, storage capacity is rough, transportation. So they can look at how many fatalities at each hospital and identify what resources they're going to need to send to which respective hospital to assist with decedent identification. So they can already know where they're going to have to coordinate their efforts. They also can work with that hospital for temporary storage. So they can work together to make sure they're taking care of the family members appropriately or the victims appropriately. So we did proof of concept back in January of this year. We started with the pre-alert. 10 minutes later, we did the confirmation alert. So we pushed that messaging out to test that system. We chose 10 minutes because typically active shooters will take themselves out or be taken out within 10 minutes. That's the standard time, and it ranges. We tested all components of the system, start to finish. So we tested the platform, we tested the family tracking platform. So all we did was give a QR code to family or to the volunteers and said, have at it. We didn't give them any instruction. Here's a QR code, fill this out as if you were a family member and see how easy it was for them to fill out with zero instructions. And then we had the victim tracking side and then the reunification side. So what we found when we did this is that Phoenix Children's was actually able to release or activate 40 anesthesiologists, open up 27 surgery suites in 45 minutes, which is pretty phenomenal. There was a bed count stipulation when we found this, and that was during that time. That week, the bed count was significantly less than a week prior. During this time, it was the trifecta of influenza, COVID, and RSV. So the bed count was significantly less. So as we test, we want to get more of a median average or idea of what it has on the facilities. Then what we did is we did the pick position training. We did just-in-time training. We picked 2 firefighters, and we trained them with the QR code, said, here's how you use it, start entering the victims. Then what happened, which was pretty awesome, is they started training each other. So they started pulling out their phones, scanning the QR code, and they instantly started training each other. And then what you saw is you'd have them separate and say, you take those 5, you take those 10, you take those 4. And then they started entering in the system and working together. And they didn't break it. So they didn't break it. And they trained on the fly, so we call it firefighter friendly, which is pretty awesome. And the other part is we trained cops to do it, and they didn't break it either, so it's cop and firefighter friendly. So that's a win in itself. Then what we did with it is we did the reunification side. So we came back and had 10 teams of 2 trained up with very, very basic training on how to log in and then how to use the filters to filter down. So they would pair up in teams of 2. One was on the victim side, one was on the family side, and then they filtered down. And they were able to match up 48 of the 99 victims within an hour. And this is with very crude training. 26 of those were accurate, 8 were not. One of them was way off, and I questioned if they were drinking that afternoon. I'm just kidding, they were not. I was. I'm kidding. So anyways, they were inaccurate, but 14 we couldn't verify because of a process problem. So what we ended up doing is we had those 2 columns that I was telling you about with reference numbers. We moved them all the way to the far right side, and it was something where we thought it would be distracting. Well, it was, to the point where they forgot it. It was out of sight, out of mind. And so we did a process problem that we created. And so we moved them back over, and then we also created a status tab so that we can identify and not duplicate efforts. So that's what we found out, and we made big improvements to it based on that testing. So from this, we just continue to develop platforms, and poor Corey, he's like, enough already. But we come up with these ideas because we sit there and go, well, we could do this, and this can make it better. So we created a family reunification center registration platform. So this is families who come into the FRC. How are we doing with time? Okay. Oh, well, thank you. No. Yeah. Okay. Come on. Do you want to come up here? We can. Okay, my apologies. Okay, you're my timer. Okay, thank you. So, Family Reunification Registration Platform. This is for the people who are at our Family Reunification Center. And one of the things is we wanted to know, how can we take care of you while we're at the center? You're already having a traumatic experience, but what are some of the needs that you have? So with this, we get information about them, we get information about their family that are with them. If they have any childcare needs, if they have any victim assistance needs like mental health, spiritual, religious, that we can help with. And then we also ask any disability access or functional needs that we can have in there. So we make sure that we're taking care of them appropriately. On the back end of the platform, we also identify if they've been reunited with their loved one, and if that loved one was alive or deceased. If they're deceased, it's a 1-to-1 ratio that we need to take care of them, versus if they found their loved one who's alive. And so we're able to take that information, we can download it, and we can give it to the Family Assistance Center. So when we transition for longer-term recovery, we have that information, and we can be more proactive in trying to get them resources a month out, 2 months out, 6 months out. And so it helps with that longer-term recovery and taking care of our community better. We also developed a law enforcement platform. So this one, we sat there and I thought, okay, what do we do with all these people who are around the scene, who witnessed it? You want to get the fresh witness account, but they want to go. They don't want to be there anymore. And so how is it that we can actually get that fresh perspective and not have them start talking to each other and messing the story up? So what we did is we said, well, let's make a platform, Corey. And so we created this, and it's very simplistic again. Name, phone number, email. Take a picture of their license, take a picture of them, and then were you hurt, yes or no? Was anybody near you hurt, yes or no? Do you need victim assistance services, yes or no? And then there's a record button, and that record button says, essentially, tell us what you saw, what major things stood out, and give us your eyewitness account so we can record it. Then what's nice about it is on the back end, we can prioritize it and say it's high, medium, low priority, or it's a key witness, tertiary witness. So the investigative team on the back end can go in and start to prioritize and essentially triage it, and they can start to assign out to their respective partners for the follow-up interview investigation. The other nice thing about this is it can all be downloaded. So if you have FBI, ATF, or other agencies that come into play, this information and all the eyewitness accounts that are first taken can be then given over to those teams for investigative purposes. Lastly, we've got an evacuee registration platform. And so this is one that we created in looking at some of the things, and this was our conversations with Red Cross and our partners there, and really identifying what can we do when it's an evacuation, but they don't go to the hospital. How do you take care of them? So the evacuee registration platform, it's more broad in who fills it out. So it could be fire, law enforcement, NTSB, FEMA, any of those partners. And then we took the FEMA list of the different events, so wildfire, tornado, hurricane, earthquake, those, and then we also added in explosions, collapse, transportation accident, hazardous chemical release, and then other. And then underneath that actually has a list for the name of the incident. So if there's multiple wildfires or if there's other problems, multiple events going on, we can designate which one we're working on with that evacuation center. Then after that, it's very similar to what we have with the family registration platform. So a lot of that information, but longer term, do you have financial needs, clothing needs, shelter needs, transportation needs, animal care needs? Do you have large stock animal that you had to leave behind that we need to go help take care of, or just your normal pets? So we have that added in and the location of them. And then do you have anybody missing, any family members that are still missing? So they can enter that information in and then add a picture if they have that with them. And so that's the evacuee platform. Based on what we saw in Maui, we are going to be improving this platform. So looking at real-time events around the world and around the country will help us improve these platforms too with after actions and just lessons learned. But seeing how evacuation occurred there, adding in photos to the actual names of each evacuee that we find, we can do. And then we can have the family tracking side still and do the same thing that we would do with the victims that go to the hospitals and those that families are looking for, filter down and try to find them and match them up. So this will get improved based on what we're seeing real time. So looking at long-term recovery. This is some of the things that we look at, and until now, it's been us and our assets, our deployable assets that we use to stabilize an incident. But then looking at the long-term recovery, the community stabilization deployable assets, we've got our partners on the left-hand side that would be assisting with that. That first bullet point on the capabilities is going to be on us, the Family Reunification Center, so they'll help supplement and support us. And then as it transitions to a Family Assistance Center, that will then go to those partners who will take that over and assist for the longer term recovery. Getting the Resiliency Center, getting restoration of services, infrastructure, housing, and then also helping with the health and social services on the long term. So these are some of the things that they'll be assisting with. So then future considerations. So all of this work has been done over the last year. It's been a tremendous effort by a huge collaborative that have come together to make this happen, but we still have a lot of work to go. So this is the foundation, and we've got some work to do. One of the things that we talk about is the rural considerations. So we have a very robust system with fire, EMS, law enforcement, and the hospitals here. If you're not aware, we have 12 hospitals that are level 1 trauma centers, all within an hour drive around the valley. That's a lot. That's not what they have in Prescott. They don't have a level 1. I think they have a level 3 is what they have. Level 4, thank you. So level 4. So level 1 facility for trauma is not available everywhere, and we've got 12. So that consideration, and how can we take this core foundation and then apply it to our more rural areas? So there's 4 components that we can have. The early alert, you can still do. The platform, you can still do. The local reunification coordinator, you can still do, and the deployable asset, you can still do. And then you start to look at what are your hazards, what are your resources, what's your fire, EMS, law enforcement, and hospitals, and how can we fill that gap? What are the partnerships? What are the mutual aid compacts that need to occur in order to make the response better in that area? And that's what we'll work towards. Forensics and crime lab. So this also came from talks and looking at what happens around the country. So Surfside Collapse brought this one about. So Surfside Collapse was in Florida. And how do you identify and how do you use resources? Because medical examiner's office is limited. So how can we partner crime labs and make sure that we are able to use resources between each other? And how can we do that appropriately? So sharing resources with forensic crime labs around the valley and then expanding that statewide. School districts. So having the partnerships with our school districts and being in lockstep and understanding what we're going to do with response to schools and trying to reduce the impacts of the Uvalde effect that we're seeing from what happened in Texas and easing the cares and concerns that we have with our parents. So how do we build that partnership? How do we build that trust again with the parents so that they're comfortable sending their kids to school? This probably is the one that I'm most excited about getting solidified at some point, and this is facial authentication software. So integrating facial authentication software into the back end of the platform. So anytime a new photo is added in on either side, it will scan, and if there's a match in the system, then it will pop within about 2 to 5 seconds. That will decrease time significantly, make this a much more efficient process, and then we can focus on getting the family members reunited to their loved ones. So the thing that's been hindering this is cost, and as we've said, basic principle, making it cost effective. So finding a way that we can do this and still keep it cost effective is going to be the solution. And then finally, looking at our civilian military partnerships and making sure that we understand what resources are available, the magnitude that we might have, and then what the process is to get those resources going and the appropriate timeframes. So building that partnership and keeping that partnership growing with our civilian military folks. So these are some of the subcommittees, or these are the active subcommittees. When we first started this, we had a lot more subcommittees working on this process, but these are the ones that we have right now that are current and active and working towards this. And actually, we have an additional one, which is air operations, and that will assist with getting resources to more rural areas, supplies, subject matter experts that we might get to more rural areas to help stabilize an incident until we can get them down to the valley to a level 1 trauma center. As Michelle said, when this started, it started with the two of us with a crazy idea and a concept, and then we slowly started bringing our partners in, starting with McDem and DEMA, and then we brought our hospital partners in. And then now we're at over 90 agencies, so this is not a comprehensive list, but we're at about 90 agencies now that are working together around the valley to support each other and to be able to respond to these type of incidents. So it's a lot of information. I'm sorry, because that's a lot of information to digest. But it's a testament to all the work that's been done in the Valley. It really is an amazing process and program that we've seen created, and just couldn't be more proud of the work of everybody. So I think we have 5 minutes. We try to limit the amount of time for questions. No, I'm just kidding.
I have a statement. Just for everyone in the audience, a year to do all of this is insane. And these women have accomplished so much. And so I truly want you to give them a round of applause. And they've also been given an award for this. And so I hope that someday we see this as a national best practice. And you guys are one of the first groups. I mean, they've been giving this presentation, but you're one of the first groups to truly see this full circle. It's been a work in progress over the last year. And as an emergency manager and someone that is responsible for an entire city, this is a gap that we didn't have. And this is something that it's not if it's going to happen. It's now when. When is that mass casualty incident going to happen? And I can't do this alone. And so I'm so grateful for these two and all of the work and the partnerships. And I just hope you know what you just heard in this last hour is a tremendous amount of work. Good.
Great job. I really love the technology solutions you've come up with. I have a question. I was wondering what effort is being made to harness the considerable capabilities of smaller nonprofits and also community members with specific skills that could be called on to flex your capability. I was a volunteer grief counselor at the Veterans Coliseum during Hurricane Katrina, and the victims there complained about the major human nonprofit and animal nonprofit as being very ineffective in their response. So I'd like to help if I could.
You're on board. We'll get with you afterwards. Honestly, when it comes to that's part of what we try to do is just continue to expand. And that's how we've gotten to the point where we are, is that when people hear the presentation or when we start the communication, they're like, how can I help? And that's been, I think, the most phenomenal part is how can I help and what can I do to be a part of this? Because that's what it's going to take. It's going to take a whole community coming together. And that's why we said it has to be a regional approach, because if we can pull our community together to help with this, that's how we're going to make a difference. So knowing what those connections are, knowing the groups, and then just continuing to build out. And that's what we're trying to do, is how do we make us more resilient by having those connections and partnerships. So you're on board, Hotel California, you're not getting out. Other questions?
Well, we are coming up against the end, and I
Thank
know, Assistant Chief, and it's one of those things where you mentioned it quickly, and I just want like a 10-second question, but how closely do you monitor situations like Hawaii? And, we're coming up on the 6th anniversary of the shooting in Las Vegas. And how do you communicate with other large metropolitan areas what you're doing? Because Michelle's right. I met Michelle the first week she was here. Somebody said, hey, you got to meet this person. And I'm just so amazed about what you've done. But how closely do you monitor that?
All the time. I think that's a part of anything that we do. I mean, in fire EMS and then in emergency management, and having the ability to have both in the division is you're always scanning what's going on around the country, around the world, to see how you can improve your own systems and how you can be better or learn from somebody else's, because we shouldn't wait till something occurs here before we actually respond. So we should be building it now, and then when it responds, hopefully we do that much better. And it's not going to be perfect, I promise you that. But we can be better prepared and more resilient. And so that's part of it, is really scanning what's going on around the country, around the world, because it's not just here too. It's really to see what we can learn from those lessons and then build into it from that. So that's a component. So it's constant.
Yeah, I would have to say, I always think those things are tragedies, right? You know, we see them every day almost, it seems, right? We're always seeing them in the news. But I always think that if we don't take whatever we get from that, those lessons learned from that, and we don't turn it around and do something positive with it so that we're prepared, then it's even worse, right? It's even a worse tragedy. I feel like that's our responsibility in our occupations. So.
Wonderful.
And then the other part you asked about with sharing with other communities, other places is, you know, really what we've been trying hard to do is get it situated Maricopa County first and then spread it out to the rest of the state. But we are talking with various partners. So we are presenting in different places. We are going to be presenting at the International Association of Emergency Managers in November and hopefully having these conversations with various people there. Same with our Western Fire Chief Association. So we're trying to expand out. We want to be mindful of it because we don't want, you know, people to go, well, can we have it? And we need to take care of, you know, we're trying to take care of Arizona first so that then we can expand out beyond that and hopefully we will be able to.